Namaste, I'm Dr. Sudheer Dara, founder director of Ipion Pain Management Center. Ipion Pain Management Center is to give a long-lasting pain relief for all the chronic pain conditions. We have 6 centers all around South India. We have 3 centers in Hyderabad, 2 in Bangalore, and 1 in Chennai. The main purpose or main treatments that happen in these centers are any joint pain. Take for example knee joint, ankle joint, hip joint, shoulder joint, or spine, lumbar spine or cervical spine. Any chronic pain, any pain related to our human body, whether it is abdomen pain or whether it is any joint pain or spine pain, you need not go for the surgeries. In Ipion, we have all the non-surgical solutions to get relief of all these conditions. So do visit Ipion for all your chronic pains. So the main purpose of me entering into pain medicine is, previously I used to work as anesthesiologist. You all know what is anesthesia means. So anesthesiologist is a doctor where whenever you get a surgery, you undergo any surgery, he is the person who will make you completely pain-free during the surgery and even after the surgery. When the surgeon cuts your body, when a surgeon cuts your body and replaces something or sutures something, during the surgery, you should never have any pain. And even after the surgery also, the post-operative pain is also dealt by anesthesiologist. Anesthesiologist's job is very critical because sometimes what we do is, we stop your breathing so that no surgeon can enter into those parts where he operates easily. So when you're breathing, sometimes surgeon can't go to the structures he wants to operate. When he wants to operate on inside the abdomen, near the stomach, near the uterus, near the some other parts inside the abdomen, if you're breathing, the surgeon cannot enter there. So at those times, we'll stop your respirations also by putting in the tracheal tube. So such a critical job is anesthesia and anesthesiologist. So now, while doing anesthesia, while giving anesthesia to thousands of patients, what I could understand is, particularly the surgeries that are happening on the joints and the surgeries those are happening on the spine. Not all the cases, all the joint pains, all the spine pains, they don't need a surgery. So if 100 members are having a knee pain or a spine pain or a shoulder pain, only 5% of the patients might need a surgery. So then what is happening to these 95%? So these 95% people, they still suffer with pain or they might get addicted to painkillers. So that's a dangerous thing. So while doing this anesthesia, while seeing the patients undergoing major surgeries, what I thought is, can we stop these surgeries or can we minimize these surgeries, minimize this surgical damage, or those people which I told you, the 95% who are not suitable for surgery, can we do something for them instead of giving them painkillers? Then I searched, then I researched. Is there anything else which is there in the world where all these chronic pain patients can get a relief without surgery? Then this pain medicine and a lot of treatment modules in the pain medicine have come up. So I searched, I researched, I studied and found out this chronic pain management is going to be a very, very useful and beneficial to the humankind, not going for unnecessary surgeries. So that's how I started my pain management, and I have started treating the patients and started creating the awareness in the public that for every joint pain, for every spine pain, you need not go to the surgery. If surgery is mandatory, if surgery is must, you have to go for surgery, but most of them, they don't need surgery. And pain management center or chronic pain management clinics are the best solutions for this. So this is how, when I was doing anesthesia, I got an idea that so this can be done. These patients, these 95% patients who are not amicable for surgery, who are not affordable for surgery, who are not fit for surgery, they can be benefited by a lot of number of interventional procedures like small injections in chronic pain management. That's how Ipion started. That's how Dr. Sudheer Dara's career started. Yeah, the philosophy behind treating chronic pain patients is a suffering. The way the people suffer. The prevalence of chronic pain in the society is around 30 to 35%. That means in 100 members of population at any given point, at any given place, 30 to 35 members, they suffer with chronic pain, and with this chronic pain they lose their jobs, they stop going to their jobs, and stop earning bread for the family. They don't have a proper kind of lifestyle, and they suffer, and some people are bedridden. And this type of suffering in the human is the basic philosophy behind me treating these chronic pain patients in my pain management centers. So no one should suffer with pain. Pain is basically not a disease. Pain is a condition, is a symptom. But nowadays, this chronic pain has become so much, disturbing to the humankind that people are psychologically deprived, spiritually deprived, physically, and also mentally. There are lots of changes that happen. The philosophy behind me starting the pain, practice is to reduce this, mitigate this type of suffering from the chronic pain patients, and which is very easy. It's a simple treatments what we do in the chronic pain management centers by giving small injections, giving them long-lasting relief. So the education of the patients should start from why this pain has occurred to you, why a patient is suffering with knee joint pain, why a patient suffers with a spine pain. They should be knowing, they should be educated about what is happening. Now take for example, a housewife. She suffers or she gets pain at the age of 45. She should be knowing that why a housewife gets pain at 45, why she is getting pain at 45. 45 is a very younger age in medical field. So why it is happening so? You need to tell her, you need to find out what is happening in her, what she is undergoing, what are all the unnecessary things she is doing at home to get the pain. So that should be explained. Then afterwards, you need to search, you need to explore the causative factor of that particular body. If the patient is having knee joint pain, you should be understanding what is happening inside. It's not the whole knee joint which goes into wrong. It is one structure which goes wrong and creates pain. So you need to find out and tell it to the patient. So this is, if your knee is paining, the main reason is the cartilage. The cartilage has gone down because of your work, because of your standing activities. So then we will explain that to the patient. And what we need to do, not for the surgeries. What we have to educate the patient that if this cartilage gets corrected, if this cartilage gets remodeled, you will come out of it. And you need to explain that. And finally, you need to tell the patient how to take care of that cartilage, how to take care of that remodeled or repaired body with small injections, with the regenerative therapies or whatever the chronic pain treating modalities what we do. If we can understand, make them understand that how to maintain them, how to protect that particular structure which got repaired. So these are all the things which is known as a comprehensive treatment. It gives you a very good insight to the patients, and patients will start understanding their problem. And that understanding will lead to a long-lasting relief for the patient. If you just do a treatment, if you just do a surgery, if you just give a 10 days of physical therapy, or you give medications for a few days and don't tell anything to the patient what is happening to the patient, this will absolutely a wrong treatment that is going to happen to the patient, and the pain will never get down, and the patient will go into more of psychological stress. Coming decades, pain management centers and pain management specialty is going to be a big game changer. So all the surgeries which are happening on the joints and also on the spine, they are going to come down. So basically, patients who are suffering with chronic pain and not getting any treatment, they are addicted to the painkillers. This pain management procedures, pain management centers are going to be the next decade, coming decade, it's going to be the one answer for everyone. So the main object of pain management centers are to make the patients pain-free and to avoid the unnecessary surgeries on the humankind.
What are the same of the most common cases of chronic pain you see in your practice?
So the commonest chronic painful condition what we see is the knee pain. So knee joint pain, because The reason for the knee joint pain is nobody is aware of the reason why knee joint pain comes. The common public, they don't know, particularly females, the working females and also household housewives. Because the way the females in India, they work, continuously they stand and continuously they work without giving any rest to the body. The first object, that first part of the human body gets affected is the knee joint pain. Second is the back pain. So back pain is also directly proportional to the work unnecessarily you do in the day-to-day life. Next is the shoulder pain. Then afterwards, any joint pain. It can be a wrist pain, it can be a hip joint pain, it can be ankle pain, it can be a elbow pain, it can be a small joint pain. So lots of joints are there in the body. Any joint giving you trouble, causing pains since long, the answer is the pain management centers, pain management speciality. So any chronic pain, take for example cancer pain. A lot of patients will they get cancer, and the major symptom with which a cancer patient suffers is pain. If you compare the cancer pain with the other non-cancer pains, the cancer pain, the magnitude of the cancer pain is very, very high compared to the non-cancer pains. So treating the cancer pain is in the purview of only the pain management centers. So these are all the things, these are all the different types of kinds of pain which can be happily treated in the pain management centers. So chronic pain is always associated with mental and emotional kind of damage. So a chronic pain continuously haunts you. A chronic pain continuously make you worry about what is going to happen in future. You always know the morale, the empathy, the emotions, the mental stability will go off. So basically you will not enjoy your life, you don't go to your job properly, you don't maintain your friendly relationships, family relationship. So the mental and emotional aspects are very, very high if a chronic pain continuously be there with any human being. So the chronic pain should be treated first, then afterwards you have to take care of the mental and emotional aspects of the patient also. It's basically a holistic approach or a comprehensive approach in chronic pain. We alone can't be doing everything. So we need to have a psychologist along with us. We need to have a physiotherapist along with us. Sometimes we take the help of orthopedic surgeons. We take the help of neurosurgeons also. Some cases are really it's mandatory for them to go for a surgery. If that case are this, we'll always send the patient to the surgeons. And sometimes we have to take care of the psychiatrist also. Sometimes there will be a psychiatric illness along with the chronic pain. Sometimes psychiatric illness will be, as a result of the chronic pain. So all these doctors are very, very important in chronic pain management, because if you go to the Western countries, there is a multidisciplinary approach for any chronic pain. In our Ipion center also, so we have a lot of, we have a group of doctors. Wherein the psychologist will be there, physiotherapist will be there, dietitian will be there, an orthopedician will be there along with us in Ipion in pain management centers, where we treat a chronic pain with the help of all these doctors. Alone we can't do. Every patient is different, every condition is different, every patient and condition must be treated properly with the help of all these doctors. Always there has to be a balance between the pharmacological and non-pharmacological treatments in chronic pain management. In pain management centers, particularly in EPON, we have our protocol to deal with any pain. So patient comes with a pain. So we take the care of the age, their work, their activities, their desires, how is the condition, how much is the damage and all. If we want to start with a pharmacological treatment only, then we'll start with the pharmacological treatment. If that pharmacological treatment is already over by other doctors, they have been prescribed by a lot of other doctors with all these pharmacological agents, then there is no point again continuing with pharmacological agents. But whether the pharmacological agents have been properly given to the patient or not, we'll see. And with the major stay of this, chronic pain management centers is non-pharmacological, because pharmacological agents, they have very limited, role in the management of chronic pains, because chronic pain is a pain where it lasts for months and years. You cannot be taking painkillers continuously, because they go and hurt the liver and kidney. That's why it's always the non-pharmacological treatment which is very safe to this chronic pain patient pains, and you need to combine the non-pharmacological agents along with the pharmacological agents properly in a customized fashion to the requirements of that particular patient. Then only the patient will get a good pain relief, long-lasting pain relief. Some patients will be there who are with anger, highly frustrated, and also deeply depressed, and they might have lost the hope on the medical fraternity, because since years together they have been visiting a lot of doctors, lot of hospitals, and they don't find any answer over there. So these patients are very difficult to handle. The major help that can be given to these type of patients is a chronic pain management centers, because we treat not only the condition of the patient, we treat the patient himself. There has to be an empathetic way of dealing with the patient. We first need to listen to the patient, what he is telling. Lots of doctors, 90% of the doctors, they don't listen to the patient. They just take the MRI, they just take the X-ray, they just take the scan and diagnose and give the treatment. In our centers, we first listen to the patient. First, we listen to the patient, what he wants to tell. We can understand and we can diagnose a lot of things by listening to the patient. Listen, listen, listen. This is what is the secret of treating such type of patients. You listen to the patient, 50% of his pain will be completely off, because he might not have seen any doctor who is listening to the patient so much. So you need to listen. The very reason why we need to listen to the patient is lots of information we get from the patient. So the listening to the history of the patient is very, very important. I tell to all the doctors, you start practicing this way, these patients all will be very happy. So once you listen to the patient, you can come to a proper diagnosis, and you start telling that to the patient will listen. If you don't listen to the patient will never listen to you. This is the dictum. You have to listen to give at least 15 minutes of time for such type of patients to start speaking. They will start with lot of uninterest in explaining you, because he might have explained this to hundreds of doctors. They feel like this is a one doctor who might not be having any clue for my treatment, for my condition. But if you start listening, showing interest into the patient with eye-to-eye contact, he will start telling all the facts about his condition. Then that will make the patient bond with you. There will be a strong relationship between the patient with the chronic pain who is frustrated, who is in agony, who is in anger, and with the doctor. So that will create such a great belief in you, so that whatever the treatment you are going to give will be very, very successful. So ethically, there are no any problems, but only thing is sometimes you don't get a proper relief in treating the patients. Then you feel bad. Patient gets disappointed. Chronic pain patients, treating them is a very difficult task. It's not that easy. So if you have some disease, if you have appendicitis, removing the appendicitis from the abdomen will completely cure the patient. If you have a cataract, put a new lens into the cataract. That's 100% sure-shotted within chronic pain patient. It is not like that. In chronic pain patients, there are a lot of ethical issues which can happen. I treat a patient looking into his agony, looking into his pain, looking into his suffering. So sometimes if the patient doesn't get a proper relief, then the ethical problems sometimes they might arise, but we as a doctor we need to tackle all these issues. The major advice that I am going to give to the humankind, all the people, don't overuse your body. Don't overuse your body. Whenever you are doing some activity and you're getting pain, consult a doctor. I am telling you, there are lots of exercises which in the public, they are doing it unnecessarily. The walking, which they do for 4 to 5 kilometers without taking the advice of any doctor, is very dangerous. People who are going to gym without advice of any doctor, very dangerous. People running for marathons is highly dangerous because your body is not prepared for marathons. Don't run marathons if you're not ever done the marathon. So these type of things don't do. Trekking, cycling, all these things, if you want to do properly, take a consultation of a doctor and tell your age and talk to the doctor whether can I do this particular exercise or not. Don't do all these things with an advice of some gym trainer, some physiotherapist, some yoga master, or your neighbor or your friend. Don't do that, because 90% of the patients who come to my clinic are because of their overuse of their body parts, whether it is a knee joint, whether it's a shoulder joint, whether it is spine. In gym, it can get hurt. If you walk more than what is prescribed for your age and for your conditions, walking also can be sometimes dangerous. You have to be very careful. Whenever you want to start some exercise, which is a new thing, consult a doctor. Consult a doctor, telling them, sir, this is what I want to do. If you don't do that, if you follow a non-doctor's prescription, non-doctor's advice, you are going to land up in a chronic pain which is going to haunt you throughout your life. So my advice to everyone is, whenever you want to do something new, go to a doctor, go to an MBBS doctor and ask him whether I can do this or not. And my one more advice to the housewives is, don't stand for longer times. If there is no need of standing in the house, you need to rest. So if you cook for 1.5 hour, 1 to 1.5 hour, you take rest. And again, you go for another work. Continuously standing for hours together is going to hurt your knee joint, it's going to hurt your shoulder joint, it's going to hurt your spine also. So for all the housewives, this is advice. And one more very dangerous candidates are the females who are working outside. So females who are working outside, I'm telling you, don't do much work at home. So outside, whatever you do, you are going to do good for the country, and you're doing a job and you also get a salary out of it. So you are using your joints and also the spine and all the other body parts, traveling outside, doing the job and coming back. Again, you want to strain your body by doing household works, you are going to get all the chronic pain ailments before 45 itself. Be careful. Housewives, take proper rest in between. The working woman, don't ever do too much of work at home. You need to work outside for 8 hours, but when you are at home, take rest. This is my golden advice to all the people who are right now not having any pain, but in future, if you don't follow these things, you are going to be a candidate of chronic pain for life.